Hi everyone. Today I will be speaking with Natasha, who was a patient of medical tourism. Natasha, can you tell me a little bit about your surgery? What surgery did you have and what country did you travel to?
Hi. I traveled to Mexico and I had a gastric bypass surgery to lose weight.
And what made you decide to have this procedure done in the first place?
The truth of the matter is, I was fat. I was over 400 pounds and I hated the way I looked. Weight loss surgery seemed to be the right option because I wanted to lose weight quick and I didn't have a lot of money to spend on it.
But why did you choose to travel to Mexico instead of having the surgery in the States?
Like I mentioned, money swayed my decision. My insurance wouldn't cover the surgery because they considered it to be cosmetic, and then the surgery in the US would cost over 30K. So I found a website that offered the same surgery for about 5 grand in Mexico, so I decided to go with that.
And what research did you do prior to deciding on traveling to Mexico for the surgery? I mean, were there any other countries that you looked into?
Not really. I've never been outside the country, and I didn't really want to go too far away because I knew recovery would take a while. I chose Mexico because the price was right, and they're right across the border. Um, Outside of that, I tried to do some research on the doctor, but there wasn't really much information on him.
And didn't you find it odd that there wasn't any information about the doctor available? Because I know in the US you can look up a doctor's credentials and see where they studied and any malpractice lawsuits and all that. Were you surprised that that information wasn't available for the doctor in Mexico?
Now, after the fact, yes. I kind of find it really odd, but in the beginning, I wasn't thinking about that. I saw that he had a license, and I read a couple reviews from other patients. Um, and then, again, the price was right where I needed it to be, so I was sold. I really didn't know what else to look for because I wasn't really familiar with sketchy situations and I didn't really know much about the black market and stuff like that. So I wasn't really sure of what to look for.
So, what was your experience like from the time you contacted the doctor's office to the time you went to have the surgery? Take me through the process.
Well, the assistant from the doctor's office called me as soon as I filled out a contact form online. Once she started talking to me, she made me feel real comfortable. She answered all my questions that I had about the surgery. She mentioned that a lot of people from the States had the same type of surgery, so that kind of calmed my nerves about it. Once it was time for me to have the surgery, I flew to Mexico and made my way to the doctor's office. The concerning thing about it at first was the doctor's office looked a little rundown, seemed pretty old, but since I've experienced the same thing in the US, I didn't get too concerned. The assistant I spoke with prior, she was the same person who greeted me and then checked me in. So that made me feel kind of safe. The doctor then came out and explained about what was going to go on during surgery, and then the anesthesiologist came in. They then rolled me into the OR and then had me transferred to the operating table. I really I really wasn't drowsy then, so I was still aware of what was going on. I looked at the operating table and it had a small rubber mattress. It was ripped, it had holes, there looked like blood was on it. I never had surgery before, but I didn't think that's what the room should look like. Um, After that, I just thought to myself, I'm already on the operating table. I'm not going to get my money back, so I might as well stick with my decision. After the operation started, I didn't know anything. I just woke up. I woke up to a lot of pain, and during recovery, I didn't really get contacted much by the doctor. And once I woke up, there was no instructions or any kind of care that they offered me, so I didn't really know what to do. I flew back home, and that was pretty much it.
Wow, so did you end up having any complications or anything after the surgery?
Luckily, nothing big. I did end up with a bad infection. I caught it just in time before it spread through my whole body. I believe their medical tools that they were using mustn't have been sterilized because the incision became infected. My recovery was about 4 months, and it should have been 3 weeks.
And once your complications arose and you realized what was happening, did you ever investigate further into medical tourism and some of the risk involved with the industry?
Once I was fully myself again, I did. I did some research into medical tourism, and I found some articles about the risk and possible complications. But there weren't very many articles with hard hitting facts to steer you away from it. It was as if they were saying, you should definitely have surgery abroad. Here's all the benefits, and there's a really small chance that you can die. No biggie. Just take this exotic vacation and make your dreams come true. Yeah, no, it was really frustrating.
So, what was your biggest regret with the surgery, and why do you think that so many people opt for having major surgeries like this abroad?
My biggest regret was not doing much research on it, and not really listening to my gut once I got to the office. People like me go abroad for surgery because of the money, and no one I know can just hand over $30,000 to have whatever type of surgery you want, let alone cosmetic. And then there's all these skinny models and advertisement and just the fashion industry, and fat people are hated. So I was desperate. People get desperate, and that's why I wouldn't really do it again.
So, what advice would you give to others seeking to have any type of invasive or cosmetic surgery abroad?
Be patient and do your research. If you don't have all the money to have a bariatric surgery in the US, then explore your other options. Seek help from the dietitian or a doctor. Talk about it. Go online, look up how to change your eating habits, exercise, at least attempt to lose weight beforehand. You can even talk to your insurance provider about ways for them to consider the surgery medically necessary instead of cosmetic. Try everything you can before you decide to go overseas. I know people have good experience with it, but the bad experiences can be really, really detrimental.
Well, thank you so much for speaking with me today. Your story is amazing, and I really appreciate you taking the time to share it with me. Hopefully, the listeners can get a better understanding of the medical tourism industry and make future decisions more informed about their health.
Thank you. I hope so too.